Great, thanks, Caroline. Is the mic working? Yeah? Okay. Okay, so as the previous presenters have already emphasized, we actually know already quite a lot about linkages between macroeconomic crises and impacts on children. In particular, we know that the effects are likely to be far-reaching and disproportionate for the poorest families, and in particular for children, because their experiences of poverty and vulnerability are quite different, which then in turn renders them uniquely vulnerable to stresses and shocks, with then life course or intergenerational consequences. But what I want to focus on here, and really to build on some of the points that Ariel was making earlier, is to focus on social vulnerability. So this is not to say that our work has discounted in any way the critical impacts that economic vulnerabilities can have on children and their caregivers, but we want to try and focus a bit more attention around social vulnerabilities, because we feel that they've been relatively neglected within the policy space. And we think this is particularly important given the growing consensus about the need to have a multidimensional approach to poverty and vulnerability, and that's highlighted by the recent multi-dimensional index of poverty coming out of Oxford. So this is just a recent quote from a Lancet report recently, which again highlights, as Ariel was saying, just how critical maternal and family stress can be for brain development and then subsequent cognitive development for infants right through to adulthood, impacting in turn income generating abilities. So just to set the conceptual framework that our work stems from, as you can see, this very complex framework is trying to tease out the linkages between macroeconomic shocks and then children's micro-level experiences of vulnerability. And within this, at the bottom line here, we see that the household has a range of different economic and social functions. And on the social side, we argue that families are the primary locus of reproduction, nurture, and care, but also they're responsible for physical and emotional protection and promotion of well-being. And so our starting point really is that depending on the sociocultural context, as well as policy and civil society responses to financial crises, these functions are likely to be disrupted to varying degrees. So some households will remain resilient, but others' coping abilities will be stretched, and unless specific interventions are undertaken to address these social vulnerabilities, then the poverty and vulnerability experience is likely to be prolonged. So there is considerable evidence from historical crisis episodes that we've looked at, which reveals that economic crises can often have a really stark impact on psychosocial health of adults and parents, with documented elevated levels of depression, stress, suicide, and substance abuse. So, for example, the bank did some research looking at what happened during the currency crisis in the early 2000s in Argentina, and documented that there was a doubling in emergency consultations for mental illnesses, stress, and depression, and also growing drug and alcohol addictions, and a range of other country examples here as well. But obviously these stressful events and the poor psychosocial health of parents can impact on children's own emotional and behavioral well-being. And so some of Rachel's colleagues at IDS, with their real-time crisis monitoring work, have highlighted some of these impacts. So this is just a quote from a child in Jamaica during the FFF crisis, who argued that, "I hear my mother talk and I'm aware of the stress. As a child, you feel it's your fault. You have to try to be perfect. You can't make mistakes." So a second sort of tier of stresses that we look at is that related to intra-household tensions, and again, something that Ariel and Richard both touched on. And so these tensions can be due to changes in the power balance between men and women in the household, especially if their relative income generating potential is altered in the context of a crisis. So we saw, for example, in the East Asian crisis of the late 1990s, it was often women who were able to get paid employment because generally they were taking lower paid and less secure forms of work, at least in some countries like South Korea. Then pressures to take on additional paid employment is another issue whereby we see little change in women's domestic and social reproductive responsibilities, so adding to their time poverty. Increased levels of family stress, translating into intra-household violence and addictive behaviors are also quite well documented from past crisis experiences. We can talk more about that later, but I'm just moving on in the interest of time. And so all of these factors impact on childcare, nurture, and protection in often very significant ways. It's just a couple of quotes from two of the pieces in the DPR highlight. So in the work that Sigurdsson et al. Have done, and this is quoting a Botswana mother, she said, "I had no option, I had to work. There was no one to take care of my 4-year-old, and I couldn't hire anyone as I was only earning 175 pula per month. I could only cook for the little one and tell him, when you're hungry, help yourself to some food." And then in the work that Hussein and McGregor did in the DPR, this is a quote from a focus group discussion in Kingston, and they said, "Women beat the children more than men do. When women are hungry and have nothing to eat, they beat their children and verbally abuse them. Women are more stressed." So a strong link there to stress and care quality, if not quantity. So in the short term, these deficits in care, nurture, and protection can have important effects, particularly in terms of resorting to negative coping strategies such as drug and alcohol abuse, risky sexual behavior. So Naomi Hussein, for example's work has documented the increased risk of transactional sex amongst high school girls in Kenya during the recent crisis, and then also engagement in other forms of illegal income-generating activities. And in the long term, this can obviously translate into reduced social mobility, longer-term problems of self-esteem, and just a generally compromised development. And indeed, although I think the work done for looking at effects from this most recent crisis is actually very thin, that's why we keep going back and quoting your colleagues, Rachel. Looking back at past crises, there is quite a lot of evidence to suggest that the child protection risks are really real. So during the East Asian crisis of the late 90s, the number of children living on the streets increased significantly in Indonesia and Thailand, for example, alongside increased risks of sex work, drug use, and crime. And there was a real spike in child abandonment and numbers of children taken into care. Similarly, in Latin America and Africa, during crisis episodes, there's a range of evidence pointing to increased involvement of children in paid and unpaid forms of work. And our own recent work in Nigeria with UNICEF, looking at crisis impacts, has found heightened rates, for example, of early marriage due to increasing financial pressures amongst poor households. So, how have social protection responses sought to address some of these social vulnerabilities? As Ariel has mentioned, there is growing evidence to suggest that pre-existing social protection systems and tailored crisis-specific responses can have an impact in mitigating impacts on children's well-being. But what I really want to highlight here is looking at all of these responses, the cash transfers, the public works, the subsidy programs. They've done very, very little, if anything, to address the intra-household tensions and violence. So while there's a strong evidence base to suggest that there's increased demand or need for such social services, we haven't seen any counter-cyclical spending in this area in crisis contexts. We've also seen shockingly limited responses to respond to rising rates of mental ill health. And then similarly, even though there's really quite a strong body of evidence looking at the starkly gendered effects of unemployment and underemployment in crises contexts, there's been an absence of measures to address women's care burden and time poverty through the type of social protection responses, particularly cash transfers that we've been discussing. So by way of conclusion, I want to just highlight some of the key policy implications that we would like to discuss further. As Ariel had mentioned, we agree that the evidence base is quite limited still, but we think these are some areas that need further attention. So at a very broad level, we think it's absolutely critical to continue efforts to demonstrate the importance of child-sensitive poverty reduction and development. I think what's quite disappointing is the results from the Busan Development Effectiveness Agreement last week. Children are not mentioned once in the entire agreement document. Gender equality is mentioned very strongly, which I think is great news, but there's really not a single mention of children anywhere. And I think similarly in the UK, Caroline mentioned at the beginning, there's quite a lot of discussion here about what's happening in terms of responses to austerity. And actually recently there's been a new report out saying that the focus on child poverty will be deprioritized vis-a-vis a focus on the working age poor. So I think what we really need to call for is a much clearer understanding of the linkages between the two, and to really tackle some of these issues, particularly of women's time poverty and the care burden. So in this regard, we would continue to support calls for more effective interagency institutional arrangements so that we can tackle synergistically the economic and social vulnerabilities that we've been discussing. I think it's simply inadequate for very often under-resourced and very politically weak ministries of social development or ministries of children and women to be tasked with dealing with these challenges alone. They're very real and widespread at considerable scale, so a lot more coordinated attention is needed. And obviously there needs to be greater awareness and enforcement of child protection-related legislative and policy frameworks. In terms of some more concrete measures, and I think Rachel's going to raise some more questions around some of these, we really think it's essential that more attention is paid to trying to promote synergies between these large-scale social protection programs and what at the moment tend to be very small-scale and fragmented child protection related initiatives. And I think given the real policy traction that social protection initiatives such as cash transfers and public works programs have garnered, both in general and as a response to crisis, we need to try and harness this potential and see child protection interventions linked up, perhaps through complementary services and more institutionalized links there. And here I think we need to try and learn from the relatively successful initiative with Chile Solidario. So that's a cash transfer program, but with dedicated social work interventions at the household level. Very poor families who have been in chronic poverty for many years are supported over a period of 2 years to try and address holistically the types of social and economic vulnerabilities they're facing. And obviously Chile is a very different context to many of the low-income countries we're looking at, but there are some important lessons, I think. Secondly, I think we need to do much more in terms of monitoring and evaluation, and given the limited empirical evidence that I've highlighted, I think there's some real opportunities to look at the UNICEF's multi-indicator cluster surveys or the DHS or UNICEF's child poverty studies to see how more modules on some of these issues could be integrated. 6, I think we would support Richard saying around the importance of utilizing innovative measures to increase fiscal space, so not just child-sensitive budget monitoring techniques, but also a range of innovative taxing mechanisms. And then finally, and I think this perhaps is highlighted by the failure in a way of the Busan Agreement to draw attention to the specific vulnerabilities of children last week, is the need to continue supporting the role of civil society actors and to ensure that with the real focus on national government leadership in the new development effectiveness agenda, that there are still adequate spaces for civil society to engage, and perhaps there's a need for a cross-donor, cross-sector working group on child rights, as there is with gender, that's been very effective, I think, on keeping some of these issues alive within the DAC. Thank you.
Thank you very much, Nicola.